Hi, my name is Dr. Simon Agger, chiropractor and clinical nutritionist, and today we're talking about a basic balance exercise. Now this is something that's very important to hone your stability, your endurance and your balance so you don't fall over, especially as you get older, or if you're just looking to improve your endurance and sporting athletic prowess, or just your everyday activities so you don't get injured. So we're going to talk about a couple of things. We're going to focus on the ankle ligaments. Now you can see here there's a picture of an ankle. You're pretty familiar. Front of an ankle, we've got ligaments on the sides, ligaments on the inside and on the outside. And one of the things we can do to wake these guys up is we can rub them. So if I get my ankle right through here and I just rub through here, and I wake these guys up, you can hold it, you can rub it like this, you can get down, you can rub it back and forth like this, you can have a partner rub it, just to wake those receptors up. And what I'm talking about here, I am talking about, we have a ligament through here, and we have a number of receptors in the ligament that respond to motion. And if we don't use them, or if we don't stretch or utilize the ligament and the joint much, like if we sit a lot or if we had a very sedentary job, then these guys aren't going to turn on. And we want these guys to turn on. So not only will they give us more information to our brain where our body is in space, because this is where all balance starts in the feet here, but also they will give us increased coordination, because if I can get more of these talking to us in the brain, it can tell our brain more information about where we are in space, how that's changing, and especially if we're moving at motion or if we're just standing on one leg, because we want to be able to be successful in standing up and articulating ourselves and performing sporting, recreational, or just plain work and home activities. So when we wake these guys up a little bit, and we also make sure that none of these joints, the talus, the subtalar joint, is locked, because if you've got a joint restriction in the foot and it's not moving like that, then these guys, we're not going to get as many of these guys firing. And as you know from getting a chiropractic adjustment, you know this is exactly how it works in the spine. When we get rid of restricted joints in the spine, we get more receptors. They will cascade into the brain saying, hey, we're moving better, you can relax these muscles, the joint can function better, and they also inhibit pain, which is crucial. So anybody with chronic ankle pain, let's get these mechanoreceptors working too, because that can ameliorate some of the pain that you have there. So what we're going to do with basic balance exercise, first of all, we're going to try and stand one leg just like this. And what you can see is sometimes the ankle will move a little bit, because what's happening is it's in space. We're gone from a bipedal to a unipedal stance, and the brain is gathering information and saying, wait, everything's shifting, how are we doing here? And every time your ankle moves a little bit, it's firing some of those receptors saying, brain, I'm here, brain, I'm here, brain, I'm here, because we're getting a different idea in space. Now that's pretty easy for most people, so one of the things you can do is we can shut down our visual horizon so that we're now with the eyes closed, and see how much harder it works. And that's the progression I want you guys to do. Do it with the eyes open on each side. We'll do the other side with the eyes open, very easy. Then we close the eyes, it gets a little harder, and you can see the ankle wobbling a little bit as I do this. So I'm getting more proprioception as I do that. Now the progression to that, once you've done that, is we want to go to a foam pad, and then we're going to go the same thing, eyes open, and we're going to stand there with the eyes open. And because the foam is not hard, my receptors have to work a lot harder. And this is great for balancing and increasing the communication with the ankle and the brain. And we can do it again on the other side too. And we can do it with the eyes closed. Go from eyes open to eyes closed. And you can hold yourself a little bit. I've got a wall next to me just in case I need this, because this is challenging. And then we come back. So always do it when you're in a safe place, so you don't go tanking into a wall or a coffee table or a dog or your partner. But the basic idea is to stimulate the mechanoreceptors in the ankles. That's going to increase the communication with the brain. We're going to increase the stability, not just of the stance, but through the whole organism when you're standing and doing things, increasing your coordination and thereby increasing your endurance, because you're going to get injured less, you're going to fall less, and if you're an athlete, you're going to have less problems in the lower kinetic chain. That's in the ankle, in the knees, in the hips, and the lower back. Especially if you're a runner or something like that. So again, there's the basic balance exercise progression. have fun with it. It's a great challenge to do with a partner and see who has the best balance, and you'll be amazed at how quick this turns around too. If you're having problems, have me check your feet, check for joint restrictions. A couple of adjustments usually make a huge difference, and sometimes we can, if there's a chronic problem, we can make a recommendation on an orthotic or a special shoe that we can cast or look at. But feel free to try this at home, enjoy yourself, send me your feedback, and again, my name is Dr. Simon Agger, and thanks for watching.